Today, I'm going back to the basics and I'm teaching you guys all about Medicare Part A. Hi, I'm Larry Goist, owner of LMS Insurance Group, and this is Medicare in Minutes. So in today's short video, I'm going to be taking a deep dive on everything you need to know on Medicare Part A. I'll be talking about what exactly Part A covers, how much it costs, when you should enroll, and how to enroll in Medicare Part A. So for starters, Medicare is made up of four main parts: Medicare A, B, C, and D. And your Medicare Part A is actually considered your hospital insurance. So all the things covered under Medicare Part A are when you're in a confined setting. So the first example is a hospital stay. Hospital is covered under Part A. Along with that is also skilled nursing care. Skilled nursing care, you're in a confined setting in a nursing home, covered under Part A benefits. The other two areas will be home health care and hospice care. Those are the four main things that Medicare Part A covers. So most people will get Medicare Part A premium free. That's right. That means you don't have to pay a monthly payment to have Medicare Part A. Now, to qualify, either you or your spouse had to have paid into Social Security for 10 years. They break it down into quarters. So you would have had to pay into 40 different quarters of Social Security. So if either you or your spouse had paid in for 10 years, you guys would both qualify for Medicare Part A premium free. So you'd have coverage for things like hospitals, skilled nursing care, home health care, and hospice, all under your Part A benefit. Now, if you didn't have the 40 quarters paid in, you still could purchase Medicare Part A. But that's where you're going to see these large premiums to be able to pick it up. So it certainly is possible to purchase it and still have Part A. It's just not something I see very often. So it's free monthly to have Part A, but what about when you actually use it, right? Like when you go to the hospital or you go to a nursing home, what are they going to charge you? So under Part A, for hospitalization, you have to pay a deductible. So in 2022, when you're admitted to the hospital under Part A, you have a $1,556 deductible, and that is for your first benefit period. So the first benefit period lasts 60 days. That means whether you're in the hospital 1 day or 50 days, you pay $1,556, the deductible. Now, once you've hit day 61, that's when you start having a copay per day. You'll actually pay a $389 copay per day once you've hit day 61 in a hospital. And then once you hit day 90, that goes up to a $778 copay. So again, days 1 through 60 are covered by the deductible. 61 through 90 is a $389 copay. And days 91 and on are $778 per day. Now, for skilled nursing home, your first 20 days are going to be covered in full. So if you do a hip surgery and they send you for skilled nursing recovery, if you can get out in the first 3 weeks, 20 days, you will pay nothing under Medicare Part A. But then once you hit day 21, that's when the copays kick back in. So under Part A, skilled nursing, days 21 through 100, you pay $194.50 per day in a skilled nursing facility. Now when it comes to home health care and hospice, those are both services that are covered at a $0 copay under Original Medicare. So the question I always get asked, though, is, well, how do I take care of these copays and these deductibles that are left behind by Original Medicare? And that's when you want to talk to an insurance professional about purchasing a Medigap plan or possibly even a Medicare Advantage plan. Now, that's not what today's video is about, but that is how you would fill in those gaps that were not covered by Original Medicare. So who should enroll into Medicare Part A and when do you do it? Well, for starters, anybody that's already on Social Security, Social Security will actually automatically enroll you in Part A. You don't have to do anything. They're going to enroll you and they're going to send you your card in the mail. Now, for people that aren't on Social Security, you will have to enroll yourself. And there's 3 ways you could do that. The first is you could go to your local Social Security office if they're open. Because of COVID, many offices are not open or they haven't been open as I record this video in mid 2022. Your second option is you could call Social Security. If you do that, they'll set you up with an appointment for like a month later, and then they will enroll you in Medicare A and or B. The third way, and probably the easiest, is you make yourself an account on my socialsecurity.gov. Now, we do this for our clients all the time at no charge. So if you're not comfortable using a computer or you just want us to walk you through the process, you make yourself an account. You can apply for Medicare A and or B in under 10 minutes using the online account. Now, I'm going to have a separate video on that entire process here later in the month, so be sure to look out for that. We're going to go step by step on what you do on that website to enroll in Medicare A and or B. So how do you know if you should enroll in Part A or not? Well, that answer is fairly simple. Everybody that is turning 65, with the exception of one group of people, should enroll in Medicare Part A. I mean, you've been paying for it your entire life. It's free when you turn 65, so by all means, enroll when you're first eligible. Now, there is a certain segment of people that should not enroll in Medicare Part A, and that's going to be anybody that's still working for a group employer that's contributing to an HSA. If you're contributing to an HSA and you are also on Medicare, there will be tax penalties down the road. So that segment of people, if you're working, you have your coverage through the employer, and you have an HSA, do not pick up Medicare Part A when you're first eligible, or there will be tax consequences later on down the road. Now, Medicare, they have all kinds of funny in particular rules about when to enroll, how to enroll, and all kinds of different penalties. And that's what we're here for at LMS Insurance Group. Everybody at LMS Insurance Group is an independent insurance agent. So that means we work for a majority of the companies that offer Medicare products. We can explain to you how United Healthcare's plans work, how Humana's plans work, Anthem's, amongst 50 other carriers that we're partnered with. In addition to that, we work in over 20 states nationwide, including Ohio, Pennsylvania, West Virginia, the Carolinas, Florida, and many others. And most importantly, we never charge a fee for our service. So if you guys need good impartial information on Medicare A, B, supplements or advantage plans, or anything healthcare related, please reach out to us using the contact information below. Our email is listed, our office phone. I even put my personal cell phone in the link so that if you guys need help or want to set an appointment, you can contact me directly. So thank you guys so much for watching. If you found this to be helpful, please give it a like or a share so you don't miss our future videos. And I will be talking to you guys next time. Thanks.